Hi, I'm Jonathan. Thank you for watching my video today, which is all about how to get moving in the early stages of sacroiliac joint pain. What is that? That's a form of lower back pain. What's a sacroiliac joint? The sacroiliac joint is the joint between the tailbone and the pelvis. Here we have it's named after the sacrum, it's the tailbone, and the ilium, the pelvic bone. So we have those joints either side of the lower back area. If you were to feel around this area, you would feel a nodular part, like if you rubbed your fingers over there, like a bony prominence. Sometimes people, when they're in pain, they feel like something's not right there, but actually it's just normal contours of the body, and it's a bit nodular. If you were to look at someone from behind, at their skin, you would see dimples in this area, and that's associated with that joint. This is a common source of low back pain and sciatica pain. Commonly, one side is affected. However, in pregnancy, both sides can be affected due to the ligament laxity that takes place during pregnancy. So that's a pretty strong joint there. Despite what you can see here on my little model, but there's normally quite strong bony interlocking there, and not a lot of movement takes place, but we do need to have some movement in order for that joint to be functioning happily. Otherwise, we're going to be in quite a bit of pain. It's going to be hard to stand up and walk. A big part of the function of that joint is to take load from the leg. So any load that's transmitted up through the leg with walking and standing, this area helps to absorb that, so that extra forces aren't then transmitted up into the lower back onto the discs and the joints of the spine. So the type of pain that you would experience associated with the sacroiliac joint would be pain around the upper buttocks area, or even into the leg. There's a nerve around there which is associated with that joint, and that can cause a pain referral pattern into the leg. What can be perplexing about pain associated with this area is that there can be an apparent absence of any actual method of onset. A typical scenario would be if you were sitting with your legs out straight, for example, sitting on your bed or sitting on the floor. Maybe you're looking at your phone, reading a book, and as you go to move and stand up and put weight through the leg, as you go to straighten, it can catch, and then you get an onset of sudden severe pain. What can precede that is a period of loading or overload, such as jarring forces through jogging, or maybe through gardening or yard work where you're bending and twisting. So the area gets stressed, and then it's the first main movement after a period of rest that sets it off. And what will happen then is that you find it difficult to straighten up or to put load through the leg. So what we need to do then is allow the joint to settle into rest and get over things in the early stages, so that you can start to get moving again. So usually a good position to get into would be lying. We want to take load off that joint, so lying flat on your back, or flat on your back with a support under the knees, like a pillow, and having a little bit of bend in the knees that puts the lower back into a bit more of a stretched position. So being in that position to get a little bit of rest, take load off the joint, and then subsequently, in order to move out of that position, which you want to avoid too much stress, and for that transition from lying to sitting or standing to be too painful. So it's good to prime the area with a few movements before doing that. A good way to do that would be sliding the heels up, putting a bit of bend in the knees, and then to do some movements of the pelvis, lower back. So a good thing to do, say for example, if you're lying on your back, on your bed, is to push the lower back into the mattress and then to lift it. So if you think about the curve of the lower back, so you're flattening that curve and then you're arching it, flattening it and arching it. This area here, so flattening it out and then arching it a bit. As an old spine, it's not too flexible, that one there. If you do that a few times, it gets a little bit of movement going through the pelvis. What's happening there is tilting of the pelvis. Subsequently, in that position with the knees bent, just gently rolling the knees from one side to the other, right to left, left to right, to get a little bit of rotation force through the spine. And then when it comes to moving from lying to sitting to standing, you want to segmentalize that movement. If you were to just try to go from lying to standing, there's quite a lot of load that's going to go through the spine there. It can really stress the joint, and it's just going to make you want to lie straight back down again and die. But what you should do then is turn over onto your side, have the knees are in a bent position, roll onto your side, bring the knees up towards you so that the legs clear the edge of the bed, and as you lower your legs over the side, use your arms to push yourself up into the sitting position. Once you're in that sitting position, you want to again do a couple of those pelvic tilts, so you're arching the curve of the lower back and then flattening out. Doing that a couple of times before then going up into the standing position. And once you can stand, just doing some gentle walking about the place, stimulating some normal movement through that joint in a loaded position. Over the following days or hours, it's just doing the same thing and then encouraging normal movement of the back, so that's bending side to side, forward and back. And then as time goes on, as pain starts to dissipate, you forget about it and start to move a bit more normally. So what I've described there is how to get moving in the early stages of sacroiliac joint pain. So that's going to be helpful information if you're experiencing this pain at the moment, or if you have suffered it from the past and feel like it's a bit of a recurring issue for you. But also, if you're the type of person that experiences back pain or stiffness in the morning, just going through that routine, what I've described there, that's going to be helpful to get you going a bit quicker in the morning. It's going to help to reduce some of that pain and stiffness that you feel in the morning and reduce the time that it takes to get you moving again. I hope you found that information useful. If you have, please do share it, pass it on, and subscribe to the channel to get more updates on future videos that will help you with musculoskeletal aches and pains, stiffness, and general mobility. Thank you for watching.